Clear, completely transparent urine feels like a health win, but it usually means you are overhydrated, not that you have hit peak health. And that distinction genuinely surprises most people who see it on a test strip for the very first time in their life, since we are taught the opposite our whole lives. When you drink more water than your kidneys actually need to process, they simply flush that extra water straight through your system without ever concentrating it into a deeper color, which is exactly why the shade fades toward transparent so quickly after you drink a lot. Mild overhydration on its own is not dangerous, and most people who notice clear urine once in a while have absolutely nothing serious to worry about, since the body corrects this balance again within a few hours without any lasting effect. But in extreme cases, marathon runners or people forcing down gallons of water in a short window, the body can genuinely run into real, measurable trouble fairly quickly, even in someone who is otherwise young and perfectly healthy. Drinking that much water can dilute sodium levels in the blood low enough to cause a condition called hyponatremia, and hyponatremia can trigger confusion, seizures, and in rare cases even death if it develops fast enough without treatment, which is why race organizers now warn runners against overdrinking. The healthiest urine color is not actually clear. It is the next shade over, pale yellow, and medical textbooks call this exact shade normal for a very specific, well-understood physiological reason involving your blood. That pale yellow color comes from a pigment called urochrome, a byproduct created whenever your body breaks down old, worn-out red blood cells that have finished their working life inside your bloodstream after months of circulating. Every red blood cell you have ever had lives for about 120 days, then gets recycled, and part of that recycling process eventually ends up inside your bladder as this exact yellow pigment. Pale yellow means your hydration level and your pigment output are perfectly balanced, and it is the exact color doctors genuinely hope to see whenever they check a urine test strip during a routine visit. Dark yellow uses that same urochrome pigment, just more concentrated, because less water means the same amount of pigment gets packed into a much smaller volume of liquid, deepening the color you actually notice in the bowl. In most cases, dark yellow urine is nothing more than a simple, harmless sign that you personally need to drink a bit more water sometime soon during the rest of your busy, ordinary day. Here is the detail most people miss though. Dark yellow urine first thing in the morning is completely normal, even in people who are already perfectly well hydrated throughout the rest of the day. That happens because you have gone 7 or 8 hours without drinking any water overnight. So morning urine is naturally the single most concentrated urine of your entire day, and doctors fully expect that pattern. Amber or honey-colored urine sits one step past dark yellow, and it represents one step closer to an actual warning sign, instead of just a gentle daily nudge to drink a bit more fluid. At this stage, dehydration is no longer mild. It becomes genuinely measurable, meaning your blood volume has already dropped slightly, and your body is actively compensating for that change in several noticeable physical ways. Your heart rate creeps upward to compensate for that drop in blood volume, and your kidneys start working noticeably harder to conserve every single remaining drop of water available to your entire body. Athletes and outdoor workers are specifically trained to treat amber-colored urine as an actual checkpoint, not a rough guess, during long shifts or intense outdoor training sessions in serious heat. If your urine reaches that amber shade, hydration needs to happen immediately, not eventually, because your body is already running a real, measurable, and steadily worsening water deficit right at that exact moment. Orange urine splits into two very different explanations, one that is completely harmless and one that is genuinely worth paying much closer attention to right away, without any unnecessary delay at all. The harmless version usually comes from certain foods and medications, like carrots and other beta-carotene-rich vegetables, which can naturally tint urine a noticeable, temporary shade of orange within a day or two. Certain drugs can cause that exact same orange tint too, including rifampin and phenazopiridine, a medication commonly prescribed specifically to relieve painful urinary tract infection symptoms for a short period of time. The version worth paying real attention to is different, because orange urine can also signal a genuine problem developing inside your liver or your bile ducts, not simply diet or medication use, and it should never be dismissed casually. That happens when bilirubin, a pigment your liver is normally supposed to process completely, ends up spilling into your urine instead of being properly handled and removed from your body as intended. If orange urine shows up alongside pale, clay-colored stool, that specific combination is considered a genuine liver function red flag that deserves getting checked by a doctor quickly and carefully, ideally within the same week. Pink or red urine is the color that alarms people the most, and honestly, that instinctive reaction makes complete sense, because blood in the urine is one very common, genuine cause. But blood is far from the only explanation for pink or red urine, since plenty of harmless dietary and medication-related reasons can produce that exact same alarming-looking result too, without any danger. Beets are famous for turning urine pink or red, a phenomenon doctors actually call beeturia, and it happens to some people every single time they eat beets, without a single exception. Other people never experience beeturia at all, even after eating those exact same beets, and the real difference comes down entirely to individual gut bacteria and how efficiently those bacteria break down the pigment inside the gut. Certain laxatives and chemotherapy drugs can cause that same reddish tint in urine too, completely separate from anything related to beets, food coloring, or ordinary everyday diet at all. The real dividing line to remember is this: painless red urine that shows up once and then disappears completely is usually just diet-related and genuinely nothing to worry about at all. Red urine paired with actual pain, or red urine that stays red for more than a single day, needs a real doctor's visit right away, not a quick internet search for reassurance, since delaying that visit can allow a serious cause to progress. Blue or green urine is the rarest color on this entire list, and it sounds almost fictional right up until you actually learn the real, documented science sitting behind it. Certain medications, including some anesthetics and some antidepressants, can tint urine blue or green as a completely harmless, temporary side effect of the drug itself, with no lasting consequence whatsoever for the patient. There is also a genuine, documented, extremely rare genetic condition called blue diaper syndrome, where a defect in tryptophan absorption turns an infant's urine visibly, unmistakably blue soon after birth, and it is entirely harmless. In hospital settings, certain urinary tract infections caused by specific bacteria can produce that exact same blue-green tint, caused by a pigment those particular bacteria produce called piocyanin, most often in catheterized patients. Blue urine is almost never dangerous entirely on its own. It is simply one of the strangest, rarest colors the human body is genuinely capable of producing under very specific, unusual conditions. Brown or cola-colored urine is the color that should genuinely move someone toward urgent care, not some casual wait-and-see approach taken quietly at home without proper attention. It typically points to one of two very different, serious things: either severe dehydration concentrating urine to an extreme degree, or a genuine underlying liver condition needing urgent medical attention. That liver condition causes bilirubin buildup, the exact same pigment responsible for the yellow tint seen in jaundice, just showing up inside the urine instead of the skin this specific time. There is a third, far more dramatic cause worth knowing about too: extreme muscle breakdown, medically known as rhabdomyolysis, which is a genuinely serious and urgent medical condition requiring fast treatment. Rhabdomyolysis floods the bloodstream with a muscle protein called myoglobin, And that specific protein is exactly what turns urine the color of cola or strong, dark brewed tea. This can happen after extremely intense workouts, crush injuries, or certain drug overdoses. And if it goes untreated, it can actually cause serious, sometimes permanent kidney failure requiring dialysis, making early recognition genuinely critical for recovery. Cloudy or milky white urine, meaning urine that starts out clear but gradually turns cloudy, usually points toward one of three specific things happening somewhere inside your urinary system. It could mean a urinary tract infection, introducing white blood cells and bacteria, or kidney stones releasing tiny crystals directly into your urine stream as they slowly pass through your body over several hours. Less commonly, it can mean excess protein or fat entering the urine because of an underlying kidney dysfunction that has not yet been formally diagnosed by any doctor, sometimes for years at a time. In rare parasitic infections found in some tropical regions, cloudy milky urine gets caused by lymphatic fluid leaking into the urinary tract, a specific condition doctors call chyluria, requiring specialist treatment. In most everyday cases, though, cloudy urine paired with a burning sensation, while urinating, is simply the classic combination pointing toward a run-of-the-mill urinary tract infection needing basic antibiotics. Foamy or bubbly urine, meaning a small amount of foam, is completely normal. It is just air mixing with urine as it hits the water, especially with a strong, fast stream after holding it a while. The detail that actually matters here is persistence, because foam that disappears within a few seconds is essentially meaningless, and nothing worth thinking twice about at all in everyday daily life. Foam that sits there, thick and bubbly, meal after meal, day after day, can actually be an early, subtle sign of something specifically called proteinuria developing quietly over several months. Proteinuria means protein is leaking into your urine because your kidney's filtering system, built from millions of microscopic units called nephrons, is not screening it out properly anymore, letting it pass through undetected into the bladder and eventually out of the body entirely. Persistent foamy urine is considered one of the earliest detectable signs of chronic kidney disease, and it can show up years before any other noticeable symptom ever appears, which is exactly why doctors take it seriously even when someone otherwise feels completely fine. Purple urine is a color almost nobody outside of medicine has ever even heard of, and for good reason, because it is exceptionally rare and appears under very specific, unusual conditions. It is called purple urine bag syndrome, and it occurs almost exclusively in patients who rely on long-term urinary catheters for an extended period of time in care settings. Certain bacteria in the urine break down an amino acid called tryptophan into compounds that slowly turn the collection bag purple or violet blue over the course of several days of continuous use. It looks alarming to see, but it typically marks bacterial overgrowth rather than a true medical emergency, though it still usually calls for a proper, full course of antibiotic treatment to fully resolve it. Black urine is the color your body should almost never produce, and when it does happen, the underlying cause is usually a rare genetic disorder or a serious, genuinely worrying medical condition. One documented cause is alkaptonuria, a genetic condition where the body cannot properly break down certain amino acids, causing urine to slowly darken to black after prolonged exposure to air. Certain medications, heavy metal exposure, and in extremely rare cases, advanced melanoma have also been documented as genuine causes behind black-tinted urine appearing in patients over time, which is why any unexplained black urine deserves a full medical workup. Black sits at the very bottom of this entire color spectrum, and reaching it usually means something in your body has moved well past a simple hydration problem entirely, deserving real, prompt medical attention rather than a wait-and-see approach at home.